Welcome to the Deep Dive.
Hi there.
So today we're going to dig into countertransference in therapy. Our source material, well, it really explores this complex idea, where a therapist's own feelings kind of get tangled up with the client's situation. Understanding it seems pretty key to grasping therapy dynamics.
Absolutely. It's fundamentally about the therapist's unconscious emotional reactions to the client.
Okay.
Think of it this way. Maybe something the client shares really hits home for the therapist personally. It can stir up feelings they weren't even expecting.
Right. So it goes beyond just feeling like sympathy or basic empathy. How does that actually show up in a session?
Well, it can be quite subtle. Maybe a therapist finds themselves feeling unusually defensive for a client who reminds them of, say, a younger sibling.
Okay.
Or conversely, they might feel this unexpected irritation with a client who maybe mirrors a trait they don't like in themselves. It's those kinds of out-of-the-blue emotional hits.
Gotcha. And what happens if the therapist, doesn't catch these feelings? If they're not aware, what are the downsides?
Well, that's where it gets tricky. If it's unchecked, these reactions can really cloud a therapist's judgment. They might start seeing the client through the lens of their own feelings, not the client's actual experience. Or boundaries could get blurred without them even noticing it.
But interestingly, our sources also suggest it's not always a negative thing. That sounds counterintuitive. How can these feelings actually help?
Yeah, it's fascinating. When a therapist is aware of these feelings, they can function almost like emotional data.
Data? How so?
The therapist's reaction might actually reflect something the client is putting out there unconsciously. It gives the therapist clues, hints about the client's inner world that maybe aren't being spoken directly.
So the therapist's gut feeling becomes another source of insight.
Exactly. When managed properly, it's a tool.
That's a really different perspective. Has the thinking around this, has it changed much over the years?
Oh, definitely. The traditional view often saw countertransference as a problem, something to be stamped out, eliminated.
Right.
But now there's a much more of an understanding that it's probably inevitable. It's part of being human in that relationship. The focus shifted to recognizing it and using it thoughtfully.
It sounds like therapists need a huge amount of self-awareness then. How do they actually cultivate that? What do they do?
Yeah, self-reflection is absolutely crucial. Many therapists journal, sort of debriefing their own reactions after sessions.
Okay.
Getting supervision from peers or senior therapists is vital to getting that outside perspective. And just really paying attention to their own emotional state, even physical sensations, during the therapy hour itself.
Our sources also mention different therapy contexts. Does this concept apply outside of one-on-one therapy, like in group settings or even online?
Oh, for sure. In group therapy, the dynamics can be even more complex. A therapist might react differently to various members, And online therapy, yeah, absolutely. The lack of physical presence changes things, but the emotional currents are still there. It might show up in how a therapist interprets an email or feels before an online session.
So how are therapists actually trained to, get a handle on this?
Training programs spend a good amount of time on it, lots of case studies, role-playing scenarios.
Right.
But maybe the most important part is ongoing clinical supervision. That's the space where therapists throughout their careers can safely talk about their reactions and learn better ways to manage them. It's continuous learning, really.
And one last point, the source has brought up the influence of identity, things like culture, gender. How does that fit in?
That's a really important layer. Our own backgrounds, cultural, gender identity, you name it, they shape our unconscious biases and assumptions.
Right.
So a therapist's identity can definitely influence how they perceive and react to a client, especially one from a different background. Being aware of those potential dynamics is critical for providing therapy that's genuinely effective and sensitive.
Wow. So putting it all together, countertransference is this really intricate dance of emotions between the therapist and client. But if the therapist stays aware...
Yes, if they stay aware and reflective, their own reactions can actually become a bridge to understanding the client more deeply. It highlights just how profoundly human the therapeutic relationship is.
It really does. This deep dive certainly shows the complexity behind the therapy room door. Kind of makes you think, doesn't it? How might paying attention to our own emotional responses in any professional interaction, or even personal ones, give us deeper insights? Definitely something to mull over.
Good point.
Thanks for exploring this with us.